Hello, dear students. I am Dr. Mushfig Orujov, Associate Professor of Department of Pathological Anatomy, the Azerbaijan Medical University. Today is our third lecture, and the topic of today's lecture is apoptosis, necrosis, death of human, and death science, or the post-mortem science. Apoptosis, as you know, there are two types of the cell death, the apoptosis and necrosis. The apoptosis, this is taken from the Greek name. The apo is meaning the separate, and the apoptosis is depression. It is programmed cell death, is carefully coordinated collapse of cell, protein degradation, DNA fragmentation, followed by a rapid engulfment of corpse by neighboring cells. Here we see with you four different illustrations, including the schematic illustration and histological figures. In the first figure, we see with you the normal cells that are arranged in close contact with each other and are united by cell structures. Here we see with the epithelial cells mainly. Early in the apoptotic process, there is synthesis of enzymes that needed to cause cell dissolution, but this is not associated with structural change. During the signaling phase of apoptosis, input from different pathways that we'll discuss later are integrated to decide a life-death fate for the cell. In the execution phase of apoptosis, the proteases cause profound structural change, and the apoptotic cells lose their surface specializations and structures, as well as the microvilli or some pseudopods and cell junctions, and the shrinking in size. The nuclear chromatin condense beneath the nuclear membrane. In contrast to necrosis that we'll also discuss later, the cell organelles remain normal, and the endonuclease enzymes cleave chromosomes into individual nucleosome fragments. Later, in the degradation phase, there is splitting of the cell, and the nuclear fragmentation also occurs. Each fragment contains viable mitochondria and intact organelles. The process takes a few minutes only. The cell membrane shows change in these lipid contents and bind protein to the outer surface. In the final phagocytic phase, apoptotic fragments are recognized by adjacent cells as well as the macrophage, which ingest them by phagocytosis for destruction. Some fragments degenerate extracellularly, while others are ingested by local phagocytic cells. Here we see we do the morphological events in the apoptosis that we discussed just. That is first the cell shrinkage, the organelle reduction, mitochondrial leakage, chromatin condensation, nuclear fragmentation, and membrane webbing and change. There are four main systems which are believed to be especially relevant to the triggering of apoptotic cell death in human pathology. First is signal transduction pathway. Second, cell damage pathway. Third, DNA damage or P53, P73 pathway, and cell membrane damage pathway. First, signal transduction pathway. The binding of specific ligands at cell surface receptors triggers the signal transduction cascade that activates initiating caspases. The receptors have cytoplasmic base recognition domains that interact with homologous base domains on so-called adapter proteins, carrying that signal to the initiating parts of the apoptotic pathway. For example, fast ligand-mediated apoptosis, responsible for eliminating certain classes of lymphocytes from the immune system, as well as target cell killing by T killers or by cytotoxic T cells. Cytokine-induced apoptosis of cells, as seen with tumor necrosis factor receptor-mediated apoptosis. Second pathway is cell damage pathway that initiates apoptosis by causing change in mitochondrial membrane permeability, activating caspases and causing apoptosis. For example, the free radical mediated damage, cell anexia, high intracellular free calcium levels, perforin granzyme B mediated cell death caused by cytotoxic T lymphocyte mediated cell death. Third pathway is DNA damage, or the P53, P73 pathway. Damage to DNA results in accumulation of P53 protein in the cell, and this facilitates DNA repair. If this is not successful, the P53 system modulates transcription of factors that favor apoptosis. For example, apoptotic cell death after irritation induced DNA damage, apoptotic cell death induced by anti-tumor chemotherapeutic drugs. And finally, cell membrane damage pathway. The damage to the cell membrane results in activation of the enzyme sphingomyelinase generating ceramide. Ceramide then signals other intracellular events leading to apoptosis. For example, the apoptotic cell death due to irritation-induced cell damage, or apoptotic cell death after free radical-induced membrane damage. In this illustration, we see with you 4 different pathways. The schematic view here you see the after the receiving the death signals, first the signal transduction pathways, that activation of initiating caspase that they affected to the mitochondria, or they activated the effector caspases. Second one, the cell damage pathway that provide the synthesis of the ceramide that also affect the mitochondria. DNA damage that triggered the P53 system cell death. Apoptosis is carried out by a proteolytic system, caspases. Why we call this, we use this term? Because the term caspase refers to the specificity of the proteases. The C refers to the cysteine protease. ASP refers to cleavage after an aspartate residue in the target protein. So the active site is cysteine and cleavage site aspartic acid, that meaning the cysteine aspartic acid specific protease, or shortly caspase. There are 2 groups of the caspases, first initiator and effector caspases. The initiator caspases include the 2, 9, 8, 10, that they activated by intrinsic or extrinsic stimuli, cleave and activated effector caspases. Effector caspases, as well as the 3, 6, 7 that cleave and activate themselves and carry out caspase cascade, cleave many other proteins to fulfill the whole apoptosis phenomena. The caspase 3 is a main effector caspase. Here you see the receptor pathway that triggered by extrinsic ligand. A family of membrane receptors, generally called DES receptors, regulates this pathway. For example, the tumor necrosis factor first, or FAS receptor, FAS protein, or the CD95. These receptors recruit pro-caspase 8 via an adapter protein. Caspase 8 activation, here you see the by proximity induction. And they activated the effector caspases. Mitochondrial pathway that triggered by intrinsic signals, normally when the cell is damaged beyond repair. Activation of some members of an important protein family, as well as the B-cell lymphoma 2 or the BCL2 family. Here another illustration of the apoptosis that here we see we do the intrinsic mitochondrial pathway and the extrinsic DES receptor initiating pathway that after triggered by these factors in the cells, they start the activation of the intracellular enzymes. For example, the by the action of the cytotoxic T lymphocytes that they release the granzyme B that activated the caspases, that they also resist the activation of the endonuclease or the DNA damage by the cell injury, by the radiation, toxins, free radicals, that they resist by the DNA damage that activate the p53 protein, that also affect the mitochondria, or they directly activated the initiator caspases. Now let we discuss about the morphology of the apoptosis. As we see here, the first event is cell shrinkage or the blabbing. In this electron microscopy, we see we do the cell in the cell shrinkage phase. Second one, we found here dark nucleus. The nucleus became too dark due to the disintegration of the chromatin. Here is the histological structures that show the dark nucleus. Then, as we said, the cell undergo the fragmentation, and here forms the apoptotic bodies, the fragments of the cells. This is the biopsy from the liver, and here we see we do the apoptotic bodies, the histological structure of the apoptotic bodies. Here you see the electron microscope of the normal cells and the apoptotic cells. Morphologically, the apoptotic cells shrink and the nucleus condenses. The organelles and the nucleus break up, and then the cell breaks into the fragment. As we said, that apoptotic bodies. Here you can find this electron microscopy or ultrastructure of the apoptotic bodies. Each of these bodies surrounded by a plasma membrane. Here is the schematic illustration of the final stage of apoptosis, that the apoptotic bodies that engulfed by the macrophage. Here another figures. First is apoptotic of epidermal cells in an immune-mediated reaction. The apoptotic cells are visual in the epidermis with intensely eosinophilic cytoplasm and small dense nuclei. And here the high power of apoptotic cell in liver in immune-mediated hepatic cell injury. Ultrastructural features of apoptosis. Some nuclear fragments show the peripheral crescents of compact chromatin, whereas others are uniformly dense. Apoptosis in compare with the necrosis. Necrosis derived from the Greek necros, that meaning the deadness, is a pathological form of cell death caused by lethal cell injury. It often results in tissue dysfunction. On the other hand, apoptosis is neat and quiet. It is normally a physiological form of cell death. Let we, in another slide, compare the apoptosis versus necrosis. During the apoptosis, necrosis, we see the swelling of cell in compare with the apoptosis that occurs the shrinkage of cell. Then the organelles are disassembled in the necrosis, but in the apoptosis, we see the preservation of membrane integrity. But in the necrosis, the membrane integrity compromised. In the necrosis, the cell contents released and often lead to the inflammatory response. But apoptosis, as we discussed with you, the chromatin condensated and the apoptotic bodies phagocytosed by other cells, and no inflammatory response develops after the apoptosis. Here also you can compare the apoptotic cells with the necrotic cells. Here you see the electron micrography of the apoptotic and the necrotic cells. As you see here, the membrane integrity here preserved, but here we see that the cell distracted and the cell content released from the cell. The apoptotic apoptosis you can find in different periods of the human development or the another animals development. For example, during the development of the fingers. Here you see the 41 days after fertilization, that between the fingers there is some membrane. But here you see the dissolution of this membrane or the septa after in the 56 days. This results by the apoptosis. Or another one, the elongation of the long bone during the ossification. And here is the chondrocytes undergo the apoptotic death, or the amphibian metamorphosis from the tadpole stage, formation of the young frog, and here we see the dissolution of the tails of these animals by the apoptosis. And there are a huge group, the abundant number of the diseases that here we can found with you the apoptosis. There are many diseases. Now let's discuss about the necrosis. The main causal factors of the cell injury are following. The first, the physical agents such as the temperature, radiation, pressure, electric, and etc. Or some traumas, chemicals, drugs, or medicaments, some infections, immunological factors, genetic abnormalities, metabolic and the nutritional change, ischemic factors, and etc. As we discussed, the necrosis taken from the Greek name necros, that meaning the death, deadness. Necrosis is a form of cell injury which results in the premature cell death of the cells in living tissue by autolysis. The necrosis is caused by external factors such as the infection, toxins, trauma. There are 4 stages of necrosis. First, perinecrosis, which is necrosis-like but reversible morphological degenerative process. Second one, necrobiosis, which is irreversible severe degenerative process. Third, death, the completely finishing the vital activity of a cell. And fourth, autolysis, unregulated digestion of cell by the cellular enzymes. The cellular structures, as well as the nucleus and the cytoplasm, undergo some morphological change during the cell necrosis. Here you see the schematic illustration of the nuclear change during the cell necrosis. This is the normal cells with the normal nucleus. Then the nucleus undergo the shrinkage that we call it the karyopyknosis. Then the cell, the nucleus, undergo the fragmentation that we call it the karyorrhexis. And finally, here we see the lysis of the nucleus, karyolysis. Another, my favorite figure taken from the liver, the kidney biopsy. Here we can find a different stage of the normal cells with the necrotic cells. Here we see the, for example, normal epithelial cells of the renal tubules. Here we see the covering epithelium of the renal tubules. Here is the cell, the basal basement membrane. Here is the cell nuclei, the cell borders, the cytoplasm, cytoplasmic structures. Then the cell undergo the hydrophic degenerations. If you remember the intracellular or the parenchymatose degenerations, we discussed about the pernicious intracellular degenerations that results with the necrosis. So firstly, inside of the cells starts the hydrophic or the ballooning degeneration. After this one, the cell nucleus undergo the shrinkage that we call the karyopyknosis. Then karyorrhexis that not shown in this biopsy. Then karyolysis, and finally the necrosis. Here we see no any cellular structures in compare with the normal cells. Here you can't find any nucleus, any cell borders, any cytoplasmic structures. So as the medical students, you have to differ the normal cellular structures, normal cells, with the necrotic structure. This is the in hematoxin eosin staining slides, pink, homogeneous, on a cellular mass that we call as the necrotic debris or the necrosis. During the necrosis, between the normal tissue and the necrotic tissue develops the tissue react to this process and start the inflammatory process. The inflammatory process, this is the reactive process to limit, to inhibit, the spreading of the necrosis toward the normal tissues. And here we see we do the congested capillaries or the blood vessels with the lymphocytes. This inflammatory reaction we call the line of demarcation, that demarcate the necrotic area from the normal tissue. Here, this is the bone marrow, the normal bone marrow, and the necrosis of the bone marrow. There are some classification of the necrosis. First, the types. There are some types of the necrosis regarding the etiological or the causal factors. First, traumatic necrosis that develops after the effect of the high temperature, burning, low temperature, freezing, or mechanical factors, electric trauma, radiation, and etc. Then second one, toxic necrosis. Necrosis of the, for example, cardiac muscle cells under action of diphtheria toxins, the causous necrosis of tissue due to the action of tuberculosis toxin, tuberculin. Third one, tropho-neurotic necrosis. For example, according to disorders of innervation, such as the bed sores. Fourth, allergic necrosis. Allergic necrosis occurs as delayed hypersensitivity reaction as a result of antigen-antibody reaction in sensibilized organisms. For example, the fibrinoid necrosis in the Artius phenomenon. And finally, the vascular necrosis. Another name is the infection, ischemic necrosis, angiogenic necrosis that occurs according to completely blocking the blood supply of tissue. Another clinical morphological types of necrosis include 5 types of necrosis. First, coagulative or dry necrosis. Second one, liquefactive or wet necrosis. Third one, gangrene. Fourth, sequestrum, and fifth, infection. The coagulative or dry necrosis. If you remember our lecture about intracellular parenchymatose degenerations, we discussed about the some intracellular or parenchymatose degenerations such as the pratinaceous degenerations that was said about the degenerated by the denaturation of the proteins, or about the most common manifestation characterized by denaturation of cytoplasmic protein, breakdown of cell organelles, and cell swelling. We call it as the hyaline droplet degenerations. They affect the solid or organs after the ischemia, toxic chemicals, burns, and viral infections. And necrotic cells retain their outline. Here, there are figures taken from the acute myocardial infarction. This is the coagulative necrosis, or the necrosis of the kidney tissue. Here we see the necrotized convoluted tubule. Another very good example from the tuberculosis of the lungs. Here, as you see, the Miliary tuberculosis of the lung, the caseous necrosis. This is the dry necrosis. The colliquative or the liquefactive necrosis also another type of necrosis which results in a transformation of the tissue into a liquid viscous mass. Often it is associated with focal bacterial or fungal infections and can also manifest as one of the symptoms of an internal chemical burn. The affected cell is completely digested by hydrolytic enzymes, resulting in a soft, circumscribed lesion consisted of pus and the fluid remains of necrotic tissue. The dead leukocytes will remain as a creamy yellow pus. After the removal of cell debris by white blood cells, a fluid-filled space is left. It is generally associated with abscess formation and is commonly found in the central nervous system. And after the dissolution of this wet necrosis, here develops the cysts, the cystic structures. Here you see the wet necrosis or the liquefactive necrosis of the brain, and that usually that results in a past field cyst formation. The gangrene, as we said, there are three types. First, the dry gangrene. Dry gangrene is a form of coagulative necrosis, subtypes of the coagulative necrosis that develops in ischemic tissue, where the blood supply is inadequate to keep tissue viable. Dry gangrene is often due to peripheral artery disease, but can be due to acute limb ischemia. The limited oxygen in the ischemic limb is putrefaction and bacteria fail to survive. The affected part is dry, shrunken, and dark reddish black. The line of separation usually brings about complete separation with eventual falling of the gangrenous tissue. If it is not removed surgically, a process called autoamputation. The dry gangrene is the end result of chronic ischemia without infection. This is the figure of the dry gangrene of foot fingers due to atherosclerosis. Wet gangrene occurs in moist tissues and organs such as mouth, bowel, lung, uterine cervix, vulva, etc. The examples include the diabetic foot. The wet gangrene develops due to a blockage of venous and less commonly arterial blood flow. Affected part is stuffed with blood growth of putrefactive bacteria. No clear-cut line of demarcation may spread to peritoneal cavity, causing peritonitis. Here you see the wet gangrene of the intestine. And third type of the gangrene is the bed sores, the Decubitus ulcer. Fourth type of the necrosis, it is the sequestrum. Sequestrum is the necrotic bone that is embedded in the pus or infected granulation tissue, mainly found in the chronic osteomyelitis. And here you see the involucrum, that this is the new bone laid down by the periosteum that surround the sequestra. And here you see the opening, the cloaca. The cloaca is the opening in the involucrum through which pus and sequestra make their way out. Because the bone tissue is metabolically non-so-active tissue, the sequestrum may remain here long time and to play a role of the reinfection. So it is better early removing by surgery. Here the histological illustration of the chronic osteomyelitis with sequestration of the necrotic bone tissue. And finally, final type the clinical morphological type of the necrosis is infection. Infection is a type of necrosis caused by a local lack of oxygen due to an obstruction of the tissue's blood supply. The resulting lesion is referred to as an infect, from the Latin infectus, meaning the stuffed into. There are some types of the infects dependent on their form. There are two types of the infects: conical and irregular shape. Conical occurs in the spleen, kidneys, and lungs, but the irregular shape in the heart, brain, and intestines. Depending to the appearance or the color, there are three types of the infect. First, the white infect or the ischemic infect that develops in the spleen, kidney. Second one, red infect or the hemorrhagic infect that found in the lungs, intestines, and white infect with hemorrhagic corolla that we found in the myocardium. Here you see the diagram, the table that explains the types of the infection. The red, in compare with the white infection, the red or hemorrhagic infection, mainly they develops during the venous occlusion in loose tissues such as the lungs, in organs with dual blood supply, in the liver, in the lungs, and previously congested organs. If you remember the degenerations, we discussed with you the nutmeg liver in the venous congestions. We'll discuss in our next lecture during the hemocirculatory disturbances. That here we also again will discuss about the nutmeg liver. And the red infections occurs in the red perfused tissues. In contrast to the red infections or red infect, the white infect or the anemic infect develops due to arterial occlusions in solid organs that they with the end arterial supply, the kidney, spleen, retina, and heart. We discussed about this one, red or the hemorrhagic infections. Let me pass this slide. Here we see we do the types of infection by the shape. Here you see the conical infection and also by the color. The white infection of the spleen is the conical type, and the red infect of the lung due to the thromboembolism. Here we see we do the red infections. Outcomes of necrosis. First, organizations. That is meaning the replacement of necrotic tissues by connective tissue. Encapsulation. Formation of the connective tissue capsule around the necrotic area. Petrification. Accumulation of calcium salts in the area of necrosis. Cyst formation, as we said in the wet or the liquefactive necrosis of the brain. Hyaline change, accumulation of the hyaline masses in the area of necrosis. Sequestration, ossification, that appearance of bone tissue in the area of necrosis. Regeneration, restoration of necrotic tissues. Mutilation, spontaneous tearing away of the necrotic tissues, and autolysis. Now, let we continue the second part of our lecture about the human death and death science, or the post-mortem science. Human death, or the death, is a complete and irreversible cessation of all vital processes, life in the body. The appearance of early death signs in the body is an absolute and indisputable criterion for the statement of the fact of death. Therefore, in pathological, anatomical, and forensic practice, the corpse is examined 2-3 hours after the death. The science that studies the occurrence of death, its causes and mechanisms, and change after death is called thanatology. That taken from the Greek thanatos. This is the god of death. Pathological conditions that occur before death. We call it the terminal period. First, the pre-agonal period that present sudden inhibition, sudden drops in blood pressure, inability to be identified, cyanosis, and paleness. Duration from a few seconds to a few weeks. Then agony, from the Greek the agon, meaning the struggle, the disturbance of heart and lung functions, pathological breathing, pulmonary edema, incoordination of reflexes, paralysis of the sphincters, and convulsions that durate from a few seconds to a few days. And clinical death, the deepest inhibition of the central nervous system, cardiac and pulmonary arrest that durate maximum 8 minutes. The death signs divide into two groups. First of them is relative, and second one absolute or constant death signs. The relative death signs are following: the unmoving body, then absence of breathing, heartbeat, and pulse in a short time, then circulatory failure, dilation of pupils, pain, loss of thermic and tactile feelings, and areflexia, lack of pupillary and corneal reflexes. And absolute death signs. First, apnoea, a spontaneous, prolonged, and permanent absence of breathing. Asystole, the prolonged and permanent cessation of heart beating. Continuous dilation of pupils. Beloglazov's signs, or the cat-like eye that absorb 10-15 minutes after death. Then sclerotic spot sommer larche or larche blows, the opacity of the cornea due to dryness when the eyelids are left open after death, and triangular gray spots on the cornea. Then continuous areflexia, Livor's mortis, postmortem rigidity of muscles, and cooling of the body below 20 degrees Celsius, and etc. Here you see the schematic and the gross view of the Beloglazov's signs, or the cat-like eye. Here you see this one. The types of this depending on the cause. There are 3 types of the death. First, the physiological or the natural death by aging. Second one, death from diseases, as we said, the pathological death. And forced death, that also divided into 3 types: the execution, suicide, and accident. The death signs divide into 2 groups. First, the early and later death signs. The early death signs has some types. First, the Livor's mortis, or the Livor mortis, or the spots, the corpse spots. There are 3 stages in this development. First, hypostasis appears in 2 to 4 hours after death. The blood and lymph in the body flow to the vessels in the lower parts of the corpse, because after the death, the human body became to the physical things. When pressed with the finger, the area suddenly turns white and recovers quickly. The hypostasis disappears if body position is changed, and the new spots appear according to posture. Second stage is diffusion, stasis, begins in 12-15 15 hours after death occurs due to leakage of blood plasma through vascular walls into adjacent tissues. When pressed with a finger, became paleness and is gradually restored. And final stage is imbibition, appears in 24 hours after death. The hemolyzed blood penetrates the skin and subcutaneous tissue. When pressed with a finger, doesn't change color and isn't restored. Here is the figure of the Livorus or the Livor mortis in the gluteal area in the back of the corpse. Second early death signs is ALGOR mortis, or the cooling of the cadaver. Cooling of the body depends on temperature and humidity of nearby environment, from closest presence, from surface properties, where is disposed the corpse, from death cause, age, and etc. As a rule, chilling of troop fully experienced during first day from the death moment. Drop in temperature begins from open parts of body and continues until 0.5 to 1 degree of Celsius beneath from temperature of nearby environment. It is considered that in room temperature, 18 to 20 degree of Celsius, a true temperature falls on 1 degree for 1 hour. When the ambient temperature is higher than normal body temperature, the corpse temperature begins to rise to half to 1 degree of Celsius below the ambient temperature. In unusual conditions, if man body has a temperature 20 degree of Celsius and below, it is a reliable death sign. In a corpse, body temperature is usually measured at a depth of about 12 centimeters from the anal opening in the rectum. Here you see the diagram of the ALGOR mortis, of the cooling of the body following this. That here you see the ratio of the temperature to the time. Another signs, the death signs, early death signs, is desiccature, the cadaver is drying out. It starts from the places without epidermis on the mucosa of the lips and eyes. Lips are getting darker, shrivel, and become more dense hard. If eyes were open, then surface allotments of eyeball between open eyelids gradually become yellow-gray and something shrivel. If opening the eyelids, then these allotments loosely well execute like triangles, a base of which is given back to iris, and tops are to eye corners, as called large blots. These blots serve as absolute sign of actual death. They form not before 5 to 6 hours post-mortem. In process of time drying out takes place on that places where skin is more thin, on fingertips, on scrotum, on places that exposed to pressure without damage of skin. If epidermis is damaged, then skin drying out places takes place double quickly. Damaged place is getting harder and becomes dark, surface frequently uneven, ordinary few falls back in wading with ambient skin. These allotments are difficult to cut. They are dry and more thin. Those are so-called parchment blots, which can develop during life period. Next early death signs is rigor mortis, or the cadaveric rigidity. After coming of death, all true muscles relax, become soft and pliable. However, after a while they become harder and fix a corpse in special pose, which can be difficult to change. This is one of early absolute death signs, which can be expressed over 1.5 to or 1/2 to 2 hours after coming of death. And final early death signs is autolysis. It is a process of self-dissolution lysis in organs and tissues under the influence of catalytic enzymes without the presence of microorganisms after death. Now we will discuss about the late death signs. There are following: the putrefaction, adipocera, mummification, maceration, peat tanning. First, we have discussion about the putrefaction or the corpse decay. It is the disintegration of corpse tissue under the influence of bacteria. Under normal conditions, it usually starts in the intestines after 3 days. Because in the intestines, especially in the large intestines, there are abundant bacteria, intestinal bacteria. Here is some events of the putrefaction. First, the greening of the corpse that begins in the area of the right iliac fossa in the interior wall of the abdomen. The hydrogen sulfide from gases released by bacteria in the gut penetrates into skin vessels. Here joins to hemoglobin and forms sulfhemoglobin. Second one, decay. The microorganisms enter the venous vessels, spread and clot the blood. Then corpse emphysema. Due to the accumulation of decay gases in the subcutaneous tissue, the corpse gradually swells and grows. As a result, such phenomena as protrusion of tongue and post-mortem vomiting may occur. Or maybe by the emphysema of the throat, it can be ruptures also. Then decay blisters that occurs under the epidermis and is serious bloody in color, and maybe the change in the livor's mortis. We discussed about the first late death signs, putrefaction or the corpse decay. Here you see the figure of the putrefaction and the formation of the decay net. You see here the decay net in the abdominal area of the corpse, as we said, that they forms by the action of the microorganisms that enters to the blood vessels. Next process is adipocera, or the fatty rocks, or the saponification. Adipocera is an original troop transformation which was found in moisture overabundance conditions and lack of oxygen into saponification, transform the corpses that are found in humid soil or in small reservoirs with water slowly flowing down dead water, pond, well. Rotting in such conditions slows down by the reason of lack of air and washing by water part of microorganisms. For development degree, it is impossible pinpoint the death time, true stay duration in water, weather, humid soil. Next late wealth signs is mummification or the mummification. If corpse is found in moisture lack conditions and presence of dry air attached to wood ventilation, then rotting cases, it quickly loses moisture and dries out. Mummification can be general to spread all corpse and partial when dry out only separate parts of body or the natural and artificial. A raised temperature considerably hastens mummification because assists moisture to coming out and halts rotting. That's why mummification often meets in localities with hot climate. However, possible mummification and attached to more low temperature if only found kind change of dry air. The lesser troop mass, so much the better and quicker it dries out. Attached to mummification, a corpse gradually begins shrivel, indurace, and become darker. A skin acquires properties of the pergament. Sharply falls weight of dead body, and it diminishes in volume. A weight loss can be 75 to 90%. The soft tissues become crumbled, sometimes collapse by closest mouths. Ticks can transform into powder. Time necessary for mummification usually calculates by months. Attached to favorable conditions, a corpse of adult can mummify for 2 to 3 months and child still before. A person of mummified corpses ordinarily is easily recognized, but the death date in these cases to define almost impossible. Next sign, the late death sign, is maceration. Change in the skin that occur when a corpse remains in water or wet environment. The prolonged immersion produces skin wrinkling. In 3 days in hands appear symptoms laundry's hands. In 5 to 6 days, similar change occurs in feet that calls as gloves of death. At the end of the 3rd week, the epidermis is stripped. And the final stage of the late death signs is a pit tanning. A pit tanning is an original tissue change and troop organs that got into soil with big contents of humus acids into peat bog. A corpse acquires a darkly brown coloring and condenses as if tans. From here, and name of this will carry tanning. A process of tanning is learned insufficiently. We finished our today's lecture. Let me summarize today's lectures that today we'll discuss about the cell death, about the 2 types of the cell death, the apoptosis and necrosis. As we said, that apoptosis, this is the programmed cell death. During this process, only 1 cell undergo the this and the neighboring cells not affected. The neighboring adjacent cells, they preserve their structure, but during the necrosis, the process spread into the neighbor cells, because during the necrosis, the cell they ruptures and the contents the actively lysosomal enzymes that they start destroy the adjacent cells. We discussed about the types of the necrosis, the clinical morphological types, the causal types. Then we discussed about the human death and about the post-mortem science. Thank you for your attention.